Respite services within home and institutional settings are already presently available. To date, over 2,400 clients have benefited from respite services in senior care centres and nursing homes. But again, we can do more, and MOH will be enhancing our suite of respite options so that more caregivers can benefit from respite services. We also want to ensure that caregivers can access such services in a shorter period of time. For instance, we have heard from caregivers that seniors with dementia can sometimes have difficulty sleeping and resting at night. In fact, some of these seniors with dementia can be quite active at night. Ms. Tin Pei Ling shared about caregivers who find it challenging as their own sleep then becomes disrupted when they need to tend to the seniors at night, especially if they also have to juggle work commitments in the morning. To support such caregivers, AIC will pilot a new night respite service for seniors with dementia who may have sleep and behavioural issues. AIC will partner a few nursing home providers to provide this new option where seniors with dementia can be engaged with through activities at night while their caregivers can catch up on their own rest. As I mentioned earlier, the need for respite services can be unpredictable, and we need to be able to cater for caregivers getting respite quickly and efficiently. Dr. Chia Shi Lu suggested allowing families to pre-register essential information with providers. We have been studying this idea and will pilot a pre-enrollment system this year to further reduce the time required to activate respite services. Under such a system, caregivers can pre-register their loved ones and complete some of the otherwise lengthy and somewhat laborious administrative processes upfront. Later on, when the time comes for the respite services to be availed of, providers would already have some of the key information, and this would help to cut down the administrative process and time required to enroll the senior. AIC will try this out with a few providers first, iron out any operational matters as they study it for a period of time, and then look to expand this to more providers. We will also pilot a home-based respite service for caregivers of palliative care cancer patients. Caregivers of terminally ill patients are fulfilling the desires of their loved ones by caring for them and also enabling them to pass on at home. This is often physically and emotionally tiring. The pilot would provide custodial care service for home palliative care patients so that caregivers can take a break with the knowledge that their loved ones will still be well taken care of at home.